This is an introduction to mindful awareness and body-oriented therapy, MABT. And I'm very excited to introduce my colleague, Dr. Cynthia Price. She is a research professor at the University of Washington and the director of a nonprofit Center for Mindful Body Awareness. Her clinical research and expertise is focused on interoceptive awareness and its role in health and well-being. She developed the MABT mindfulness-based approach designed to facilitate interoceptive awareness and related skills for self-care and emotional regulation. Dr. Price's research is aimed at the study of MABT within community care, community care, particularly for those in recovery from trauma, chemical dependency, chronic pain, or other life stressors. She's also co-authored 2 scales to measure interoceptive awareness, which I'm going to check out more deeply. These measurement tools, they sound fascinating. The scale of mind-body connection and the multidimensional assessment of interoceptive awareness. She provides training for clinicians and therapists interested in learning how to integrate interoceptive awareness skills in their practice or for their own self-care and the care of their clients. The trainings are available through her center, and you should have received some contact information and information about upcoming trainings in the email. So if you didn't see that, go back to your email and you will find that. Dr. Price is committed to increasing access to integrated healthcare services, particularly for underserved populations, through her research, teaching, and service. And so welcome, Dr. Price. Very excited to have you here. And I stopped sharing. One thing about questions, Dr. Price said you can feel free to throw a question in the chat, and I'll try to find a place to interrupt her if it seems feasible. If not, we'll also take questions at the end of the session. So take it away.
Yeah, thank you so much, Monica, and for having me. Let me pull up my slides here to share with you. Okay, so as Monica mentioned, I'm a research professor here at the University of Washington School of Nursing, and I remember Dr. Barnard very well. So she was extremely supportive of my work as a dissertation, as a PhD student, which was very wonderful. So this is an introduction to this work that I've been doing for my entire career. I started as a licensed massage therapist and then got a graduate degree in psychology to combine sort of a somatic approach to really helping people learn how to bring their attention into their bodies. So I was in private practice for 20 years and then moved to Seattle to do a PhD to really look more at legitimizing this kind of approach, because at the time it was still considered really out there, you could say, not very supported. So I've been really lucky to, timing-wise, get NIH funding for the research that I wanted to do over the years. And I'll tell you a little bit about that as well today. So, today's presentation, we're going to cover a little background. What do these terms mean? A little bit about this approach, and I'll lead us all in a short little experiential segment so you can kind of get a sense of what this work is. Talk a little bit about research, present a clinical vignette if we have time, and just touch on some of the things that are really important if you're wanting to teach or learn this work, and also the self-care components of it as providers or therapists, clinicians ourselves. And then we'll have time for questions and answers at the end. So body awareness is the umbrella term for any kind of awareness in the body. And it's really the most understandable term. Interoceptive awareness is a relatively new term in clinical care. Interoception itself is the processing of sensory input, and it's mostly unconscious. It serves to help us regulate. So in the really kind of more physiological aspects of that, it would be noticing that you're hungry and that you need to eat, right? Or noticing that you're cold and you need to put on warmer clothes, or noticing that you're tired and you need to sleep. Those sort of basic regulatory components that keep us well and healthy and are important for survival. And this man named Bud Craig that's listed down below, he was an anatomist who traced where the sensory pathways went into the brain to better help us understand this actually was him who, because of where they went into the brain, the sensory information, understood that it was serving a regulatory function. So his work was really fundamental to bringing the importance of interoception and interoceptive awareness, which is the part that we're conscious of, into sort of across all scientists who are interested in this kind of thing, kind of into our awareness about 20 years ago. So his work is really amazing, actually. What I want to help people understand is there's a real strong connection between interoception and mindfulness. So mindfulness is defined as the present moment awareness of what you're experiencing with an attitude of non-judgment and compassion. And interoceptive awareness is that a conscious attention to our inner body sensations. So those sensory pathways and that sensory information that's going into our brains to help us know what's going on inside, whether it's conscious or unconscious, that Bud Craig was involved with, the pieces, that aspects of that we can be aware of in ourselves is called interoceptive awareness. So in more basic physiological science, it's often referred to for just the visceral type awareness, but those of us involved in clinical care who have been studying interoceptive awareness have defined it much more broadly to include any kind of sensory awareness in the body, and that can include those relationships to emotional awareness. And one thing we know is that that area of the brain that sensory processing goes to involves very much in the areas of the brain that are involved in emotion regulation. So it's all aspects of regulation that interoceptive awareness are related to. So what's this overlap piece, in order to really attend to how we feel internally, some of that can be like surface level awareness, I'm hungry, right? But to really delve into awareness in a sensory way from a therapeutic perspective requires that we know how to really be present and bring that sort of mindful attention into the body. And that's why mindfulness, I consider this work of teaching people this work a mindfulness-based approach. Because without that present moment awareness and the capacity to bring and sustain awareness in the body, to notice and to be with what we feel, people really aren't able to engage. So, and for those of you who've ever been into a mindfulness class or listened to a mindfulness app, there's usually an introduction to noticing the sensation of your breath, the inhale and exhale of your breath. And that in itself is an interoceptive activity, that noticing of sensation. How do I feel when I breathe? What do I notice inside, right? So they're very connected. But a lot of times, folks for whom it's complicated or challenging to bring attention into the body really have trouble with going to a mindfulness class. They're like, I don't know how to, it's sort of a black box actually for researchers, knowing whether someone is engaged in a process of being mindful. But most of the time, what we find in our research is that folks really have a hard time with this, that they need individualized coaching in order to learn how to engage with how they feel inside and how to bring their attention and their awareness into their bodies. And so this work really, I think, is addressing that particular gap, you could say, in the learning process for people who are really interested in bringing mindfulness skills into their practice, or maybe mindfulness teachers. That there is an individual piece of this that can be really important from a coaching perspective, especially for certain folks, is really, really helpful. Not for everybody, but for certain folks. I'll talk more about that in a minute. So I love this quote. This is an old quote from Leslie Grunberg, who wrote the Handbook of Experiential Psychotherapy decades ago, that healthy functioning results when as many aspects of the self as possible are integrated into awareness. And so coming from the background I come from, this aspect of awareness of how do we feel somatically has often been underdeveloped. And so this work is really helpful for that. So one of the things that has happened with mindfulness research and the interest in understanding how mindfulness is helpful, so looking at what's going on physiologically in the body, what is mediating or explains how mindfulness is helpful, neuroscientists have gotten very involved in research over the past 15, 20 years. And it's because of their involvement in mindfulness research that the understanding of the role of interoception has come forward as a potential, one of the many things that is helpful about this, about learning mindfulness skills is gaining interoceptive awareness skills as well. So it's their work with oftentimes fMRI or imaging studies that has really helped us look more at what's being activated in the brain. And there's many places, but one of the primary ones is the insula. And Norman Farb is a researcher in Canada who's been very involved in and really looking clinically at what's happening in the brain in response to interventions or approaches that are really teaching mindfulness skills. And we see that there's an increase in connectivity in these parts of the brain that are involved in sensory processing. So across the last couple decades, as neuroscientists and people involved in mental health and neuroscience, and then more of us involved in the type of work I do have got involved, have kind of collaborated or looked at some of these things. This is what we know at this point, that the posterior and middle insula supports interoception and influences self-appraisal of emotion and affective symptoms. There have been lots and lots of cross-sectional studies using imaging that show a lack of sensory processing in people with mental health challenges compared to healthy controls. So those people who have any kind of mental health disorder, PTSD, depression, anxiety, people with chronic pain, as well as people with elevated stress. So there's no question that there's a difference in people's processing of sensory information when they're struggling with mental health issues, which then always raises the question, well, can we change that? Can we do anything about that to help people be able to process their sensory experience? So as you can see, chronic stress is one of them. And we know the interoceptive now underlies emotion regulation processes. So just so we're all on the same page and just talking about what is emotion regulation and dysregulation, emotion regulation is the ability to modulate. I can't read my slides, but you can. Modulate the intensity or duration of emotional responses in order to promote goal-directed behavior. And the dysregulation of emotion is characterized by intense or labile emotions, poor distress tolerance, experiential avoidance, lack of control, and vulnerability to psychopathology. So it's all about trying to be in balance, right? Like we all get stressed, We all get triggered by certain kinds of things. And regulation or homeostasis from emotional regulation perspective is all about being able to come back to a more healthy place, to be less, what's that response time? So we get stressed, but can we come back down to feeling more regulated in ourselves and able to manage that stress? And so there's many, many ways to help ourselves do that. And learning how to pay attention to your body and understand what's happening internally is one of those ways. And that's part of what this work is about. So this particular approach focuses on enhancing presence. It facilitates access to inner experience, and it promotes somatic and emotional awareness, which facilitates well-being, and really people learning to have their body as a resource for understanding how they feel. So one of the things that has come out in the literature over the years is trying to identify what are the components of interoceptive awareness that are important. And they're really defined as these: being able to be aware and identify sensory awareness, being able to access, bring your attention into your body. So that's sort of the mindfulness piece. How do you focus internally, but also sustain attention on what you feel inside? And that's also a mindfulness skill. And then reflecting on that experience, having some evaluation or meaning for what you're learning about yourself that you can put into place to help with behavior change, which involves somatic reappraisal. So the work that I developed, which really came out of my time as a somatic psychotherapist, it's called Mindful Awareness and Body-Oriented Therapy. So it's teaching people these fundamental skills that I just mentioned, of bringing attention into the body, learning to sustain attention there, reflecting on it for understanding yourself. It includes touch, psychoeducation, and mindfulness. And the explanatory model is that by learning interoceptive skills, people learn to emotionally regulate better, and that facilitates improved well-being. It's delivered individually. It's sequential in its training components, which you'll see in a minute. So it's incremental in its approach to sort of build skills over time. At this point, it's evidence-based, it's trauma-informed, and involves a home-based practice. So because I came from a massage therapy background, and I think touch is extremely helpful for learning to bring attention to the body, so that if you start kind of floating off and thinking about something else, you can feel your hand here and go, oh, okay, let me bring my attention back here. So we use touch in our trainings, we use touch in our research, but we also at this point train as many mental health therapists or people who don't use touch in their practice as people who do. And so they are translating this training and having the client put their own hand on their body, which is what we do anyway in this practice for home-based, for their, practicing this work on your own in the interim weeks. So it very much can be something that can be taught and used by clinicians who both use touch and don't use touch. So just wanted to say that as well. So when I said we teach this incrementally, this has been, went from something I did in private practice to something that got developed as a research protocol for research purposes. It's an 8-week intervention, and it's got 3 stages. So we start with those, so you can see in blue, those processes that were mentioned earlier, and I call them, and the first 2 sessions are focused on what we call body literacy, which is the work of identifying one's sensory awareness, but we start externally on the body. So we start outside and we move in to help people first develop language. Language for why it's what we call body literacy, for how you describe what you're noticing in sensory terms. And then we move to helping people learn to bring their awareness internally into the body. And we do that in a variety of ways, which is really this access piece. And I'm not going to go into that in too much detail, but involves attention to breath and some other processes and exercises we run people through. And then the last half of the intervention, which is stage 3, which is sessions 5 through 8. So it's the second half of this approach. We're helping people to focus their attention in very specific regions of the body and then rest their attention there for as long as they can. So when we start this, sometimes we're working with people for whom this is such unfamiliar work that they might learn how to bring their attention down into an area of the body, then bop right out, right? Like literally it's 30 seconds. And so the work over time is to extend their capacity to attend to what they feel internally and to stay in that region with mindful attention. So for some people that might go from 30 seconds to 3 minutes. For somebody else, it might go from 5 minutes to 20 minutes, right? So everybody's different, and this intervention is designed, or this approach is designed to meet people where they're at and to work with them individually to help them learn these skills as best as they can for where they are in their lives in the moment. So you can see from the purple, if you look down after the first row, we spend a lot of time just talking in this intervention. So we have an intake or a check-in that's about relationship building. It's about talking about how they're feeling in the body, what they're noticing. It's about what did you do with your take-home practice last week? How did it go? And then that, whatever people say, helps guide what we do next. So where we focus, but we always start with a little, initially the body literacy training is the entire time we move to a table, or if someone's working seated, they stay seated, but the focus is on really going through areas of the body and noticing how you would use words to describe how you feel. So we are going to practice that in a minute. But we always review it at the beginning of every session across these 8 sessions. And then you can see the work shifts in attention to either accessing or the mindful body awareness practice, which is just sustained attention. Then we come back, if we're working on a table, we come back to seated and do a session review where we really walk through and cognitively integrate the experience or the highlights of what people experienced on the table and collaboratively come up with a take-home practice for them to really work on some of these skills in their daily lives, because the goal is to have a new set of skills that you can help for your own self-care over time. So as Monica mentioned, if anybody's got a burning question, please put it in the chat and I can be interrupted as we go along. So this is really the 8-week research protocol that we've been using and the research I've been doing over the last 20 to 25 years. And mostly work with people for whom this type of thing is pretty challenging. So people who are disconnected from their bodies, basically, oftentimes due to having extensive trauma histories, to having chronic pain. Those are 2 primary types of examples of where a coping mechanism for getting through the day and for your emotional and physical pain is to really distance yourself or avoid noticing how you feel in the body. And that's a wonderful coping mechanism we have as human beings to survive. When you've had a trauma history that's long over, some of these patterns can continue into forever, actually, and not really serve you anymore, right? So that's the clientele I worked with in private practice for 20 years. And they taught me. They were coming to me because they'd been in psychotherapy practice often for, decades. They'd done a lot of healing and recovery, and they were still very disconnected from their bodies. And that was sort of why they showed up in my office. So it's my work with them that really taught me what will help people learn to develop the capacity to attend to how they feel internally and use that a way to know how they're doing emotionally and to shift out of some automatic patterns that are no longer serving them. So that's how this work began. And now most of my funding has been with people who are in treatment for substance use disorder, many of whom have chronic pain, and almost all of whom have extensive trauma histories. So this disconnection as a coping mechanism is often very, very powerful in those folks. And so having a way to kind of shift and be in the world with yourself in a new way is very empowering to learn. So that's another sort of side thing that we'll get more into in a minute. But what I want to do now is lead you through just a little taste of some of these processes that we're working with in this intervention so that it's not just words. For those of you who've done any mindfulness work at all, some of this will be somewhat familiar. So if you want to just sit and listen, that's totally fine. If you want to engage with these, I'm going to do maybe 5 to 10 minutes of this experiential work. Love to have you join in on that. So the first stage that we work on, right, is simply learning language and awareness of how we feel more on the external body before we work on helping people move their attention internally. It's safer, but it also develops language, and we really need people to have language to describe how they feel and comfort expressing that in order to move on with the rest of the training process, because we're constantly in dialogue, asking them to tell us what they're noticing. As therapists, we're asking the client to use their words to tell us what they're noticing. So people need to have those words, right? So I'm going to ask you, I think an easy place to go, but you can go somewhere else, is to just bring your hand up to your shoulder like I am here, and feel around, just massage around and see if you what you notice, as you kind of feel into this shoulder, whatever shoulder you're on, and maybe pause when you find something that's sort of interesting. It could be a place where the muscle is kind of elevated, or there's any kind of sensation as you press into your shoulder. And just take a minute and ask yourself, what word would I use to describe this sensation? Or there may be multiple words. And as you hold, if you're just holding a spot for a minute, press a little deeply and notice whether that sensation changes as you hold it. And if it does, what word or set of words would you use to describe how it feels as it shifts? So you have to press a little bit hard in order to notice sometimes sensation, or you have to search around for a spot where there is sensation. And usually it's because there's a tight muscle, right? So this is what we do all over the body to start. And there's these places that we're typically aware of holding tension or maybe aware of discomfort, but there's all sorts of places where we typically don't notice how we feel. Those places in the body that don't have as much of an automatic sort of kind of coming to our attention. We know we do this when we're stressed and our shoulders get tight. But for example, if you press right into your chest in the front here, your upper pecs, you could say, You may notice as you walk your fingers around and put a fair amount of pressure, there may be places that are tender. These are not things that we normally walk around in our daily life going, oh, I have a tender upper chest, right? But just notice what would be the words that you would describe for how a certain spot feels on your body. And as you hold it, so I'm just putting pressure with one finger here. As you hold it, does it shift? So these are very fundamental things. It's very simple work on one level of just noticing, finding words, and we do that across the whole body for stage 1. And oftentimes they're helping coach people on language. So a lot of times what people will say is, oh, that feels good. And that's not the word we're looking for. We're looking for a sensory word. So a word like tight or wiry or tender or achy. So there's some coaching that goes on with that. But that's the type of thing that we're working with in stage 1. So the next stage is about bringing attention from this external body into the internal body. And this is the part that this transition to where the attention is often challenging for folks. They may never have done it before, for example, or they may not understand instructions. So there's a lot of coaching and trying to find the right way for someone to understand what we're talking about and to encourage them and support their learning. So what we're really trying to do is help people notice the difference. So what is paying attention to sensation externally and what is paying attention internally? So we're just going to do, this is not something we do in our intervention, but if you just put a hand on your chest here and then just take a nice deep breath, really deep, see if you can notice the sensation of your breath coming up so high that your hand moves up. And then as you blow out, your hand depresses on your chest, right? So getting people to notice this kind of thing, so their attention is moving from out here on a muscular level to internally noticing that sensation of something occurring inside the body. So those are the kinds of exercises we do in this second stage of this intervention. We do other things too that are more complicated because we're wanting people to learn to track how their attention moves with sensation through the body. And so those of you who are familiar with things like the body scan, we don't do that exactly, but things like that, where you're tracking your attention as it moves through the body. But we work with breath and the sensation of energetic flow of breath as it goes down through a limb to be able to feel this movement and being able to track that with your mind's eye. It's actually kind of challenging and too much to do on this on this webinar at the moment, but that's the kind of thing we're working with folks. And then the last and the time we spend the most time with is called mindful body awareness, which is about sustained attention in the body. And for this one, I'm going to guide you more in a meditation. So if you'd like to do,
Before we do that, can I interrupt? There is a question about, are there words, vocabulary words that you use often with people to help them describe the sensory experience? That's one question.
We really try and have people come up with their own words rather than give them words. when someone's having a very, very difficult time coming up with any words, then we will give them a range of possible words. So when you've got your hands on someone, right? Like we're often working as therapists with our hands on a person's body, so we can feel what it is they're paying attention to. So we have our own sense of what that might feel like to them. It's a tight spot or a tender spot, for example. But even if you're not, sometimes you can see like on a shoulder that it's raised and it's probably, so we would I'm going to give you an array of words and let me know whether any of these fit with what you feel. So we do that. And there's always that concern. You don't want to put words in someone's mouth, but that's why we do an array of words so that is less likely to happen. But also we find that people really say, no, that's not right if it's not the right word. But yes, so we do that.
Okay. Another question is, do you often suggest skin to skin contact, or does it not matter over clothing, under clothing?
It doesn't matter. We work with people with their clothes on in our research. And I used to work with people with clothes on in private practice. This is not really massage per se, right? We're using massage therapists in our research because they're licensed to touch and they're familiar and comfortable doing this type of work that way. But no, it's perfectly fine to do this work over clothes, and it works perfectly well.
And then one more question, we can finish up what you were doing. Does this track with the book, The Body Keeps Score?
There's a lot of overlap in concept, right? Of the importance of the body, the importance of awareness of sensory, emotional awareness that's related to sensation in the body for understanding how you feel, for regulation, the kinds of things I was talking about earlier. There are a lot of interventions or therapeutic approaches that overlap with this work that are mentioned. For example, Pat Ogden's work, when Bessel van der Kolk learned a lot from her. And so, yes, there's a lot of overlap, and the actual processes we have for this intervention are somewhat different in terms of using touch and in terms of sort of fundamental skill building.
Okay.
But there's other things that are very, very similar, and where people go in their process is very, very similar when they engage with noticing deeply how they feel and what gets brought up for them, and then reflecting and staying in that sensory awareness process related to what does come up. So yes and no.
Thanks.
Yeah. All right. So with this last experiential piece, that's about the third stage of this work, which is about sustained presence. And again, this is a little different than this is actually quite different from what most folks do, whether it's something you'd read about in Body Keeps the Score or mindfulness-based meditation, which doesn't really focus on sustained presence in a very specific region of the body. That's not typical for mindfulness practice. For those of you who are interested, who are familiar with Eugene Genlin's work, Focusing, which was very, very influential for my work, but also lots of people in psychotherapy in terms of really attending to the felt sense. That approach too, you'd drop down into the body, but come right back up to then do more, I call cognitive or more typical psychotherapeutic processing using that information. This work is about staying in. And so it's a little different that way. And so we're going to just do a few minutes of it. So if you could, you do not need to put your hand on your chest. You could put your hand on your belly. You could put your hand, on your diaphragm, your low belly. I would say somewhere in the torso, that's easy. But if you're not comfortable putting your hand on your chest, find someplace else if you want to engage in this. But otherwise, putting your hand on your chest is a good thing, a good place to start. So I use my whole hand. I'm really making a lot of contact with the entire hand. Excuse me. And what you want to do first is notice what level of weight or pressure to put here on your body with your whole hand, wherever you are. So I am skin to skin here, but that's just because my shirt allows it. But get comfortable in your chair. Let your back rest against the back of the chair. Let your feet be uncrossed. Really get in sort of a mindfulness, careful place with yourself where you feel really comfortable. And if you have an arm on your chair, you might want to put your elbow there so that you're supporting your elbow as it's, see, that doesn't get tired. So first, what you want to do before going into more of the meditation is really notice how the tissue feels underneath your hand. What kind of weight feels comfortable, and kind of find what feels right, like you're holding yourself in a really loving way. And then kind of move your hand, like glide your hand without picking it up off your skin, and notice how much glide there is. Notice if your tissue moves underneath your hand. That's just information, okay? And then let your hand pause and just be there on your body. And I'm going to invite you to close your eyes if you feel comfortable doing that, or have a downward facing gaze, and letting your thoughts get really quiet. So you can bring your attention more internal, letting the activities of the day get really quiet, as though you've got a blanket over your thinking mind. And then inviting you to drop your attention, your internal attention, down through your head toward where your hand is holding, toward that space on the inside of your body underneath your hand. So allowing your attention to move out of your head, past your eyes, past your sinuses, down through your throat, allowing your attention to drop all the way past your collarbone and into that space of your upper chest. And what you're aiming for is that internal space of your chest, or wherever your hand is, that's in the middle of you. So in between the front where your hand is and the back where your back may be touching a chair. And see if you can just feel that sense of landing your internal attention right into that space in your body. And then resting there as though you're accompanying yourself inside. And if you notice your thoughts shifting away, just bring your attention to your hand and slowly invite your attention to come back right into this region underneath your hand in the middle of your body. And if you're able to stay there for a minute, just notice whatever you notice about this internal space. Does it feel comfortable to be there? Are you aware of any sensations when you bring your attention here? Are you aware of the size of this space inside? What are you aware of? And just invite you to just take another 30 seconds of simply being with yourself in this area of your body. And again, noticing whatever you notice. And if it's simply just noticing that you're there, that is a lot. Now, keeping your eyes closed, I want to invite you to bring your awareness back more into the room and to your hand. And keeping your hand on your body, again, just kind of notice how the weight feels. Glide your hand along the tissue of your chest or wherever your hand is, and notice how the glide is. And take a moment to just more globally notice your whole body in the chair. And notice how your whole body is feeling right now. And then very slowly invite you to say goodbye with your hand. And you can gently, slowly remove your hand from your chest and open your eyes when you're ready. And Maureen has a few questions she's gonna ask you. So Maureen, you want to do that? We'll get some feedback about how this was. So the first one is, were you able to bring awareness into your body? And it looks like most people really were able to, and some people it was a little challenging. But that's great. And then the next question is if you were able to sustain awareness. So this is the last meditation that we just did. If you were able to sustain awareness for a bit, what is one word that describes what you noticed? And it can be any word. Do you have a way to collect words, Maureen?
I think once I end the poll, I can
Okay.
share the results.
Okay.
All right, I'm going to share the results. I can read them off. Soft, light, calm, warmth, tightness, rapid breathing, calm, lots of warmth, lightness, centering, anchored, protection, relax, spaciousness, stillness.
Great. Those are wonderful things. Someone noticed rapid breathing. So, right, there's both maybe helpful information there too, but also helpful information about how much calmer people often feel with this type of work if it feels comfortable, right? And then, did you notice feeling different after the meditation? So you can see this is typical, a lot of variety, although more people in this group said they felt more relaxed and more open. Some people had less discomfort and pain, and some people were not sure or did not. So there's this spectrum, which is typical. But thank you so much, Maureen, for doing this and for folks for responding. I think that we tend to see that this on the whole is really helpful, that people do feel better when they can connect in with themselves, and it can have the impact of more relaxation, more openness, less discomfort and pain. And then there's learning how to do it and feeling comfortable doing this work, which can take some time for some folks. So I'm going to move on to tell you a little bit about the research we've done with this type of work over the years. So we've done randomized controls trials. That's what RCT means, for women in recovery from childhood sexual abuse, which is the work I started with doing in clinical practice. We've done a pilot randomized control trial for people living with HIV. We've looked at the learning processes involved over these different sequences of the approach qualitatively to understand what's important for learning. We recently did our first neuroimaging study, and I will tell you a tiny bit about that. The NIH studies have been with substance use disorder, 2 of them with women in intensive outpatient treatment for substance use disorder, and the most recent one were with men and women who are on medication for opioid use disorder. And then we've looked at this approach for people with chronic pain, female veterans with co-occurring PTSD and chronic pain, and an implementation science project for men and women who are being treated for chronic pain in a pain clinic. And then I've worked a lot with other researchers where we haven't looked at MABT exactly, but my role has been to help bring more of a body awareness focus into the approaches that are being studied. So one was, for example, with women who were pregnant, who were, we were looking at integrating more of an interoceptive focus into a mindfulness prenatal course. There's a big RCT that recently finished where we were working with Hispanic women to prevent anxiety and depression, most of whom are refugees or immigrants to this country who live in this region. And they were getting a group intervention, and we were really bolstering the interoceptive awareness component of it. So those are some examples of trying to bring this work and integrate it into other approaches as well as just MABT research, which has been most of what I do. But and then what Monica mentioned was that I've been involved in developing scales. So when I started doing research, there really was not a scale that got at these type of things that we were teaching people. So there are now 2 scales. One I developed during my PhD program. And then this one was developed during a postdoc with Dr. Wolf Mailing, who is at UCSF. And this particular scale, the Maya, has been used tremendously across the globe. And it gets at these kinds of things, whether people can notice awareness, so that's just kind of the noticing piece of sensation, whether their ability to sustain and control attention to their body sensations, whether they're aware of the connection between their body sensations and emotion, their ability to regulate distress by attending to their body, whether they can gain insight about themselves by attending to their body, and whether they feel their body is safe and trustworthy. So you can see how closely this relates to the work I do too. But I was involved in developing this scale, and I love this scale. It performs very well in research and really reflects what we're trying to teach. So we use it in our research, and we see these are just kind of overall the types of, across different studies, what we tend to see are significant increases in interoceptive awareness, basically saying, yes, people are learning what we teach them, but related to those kinds of constructs that I just went through. We see significant reductions in most mental health indicators of distress. We see improvements in emotion regulation, reductions in physical health discomfort, reductions in substance use and craving in abstinence-based programs, and continued use of skills learned when we do 9 and 12-month follow-ups, which is based on self-report but is very robust and consistent across all our studies. And I really think speaks to how helpful people experience, I perceive this work to be.
Cynthia, a couple
Yeah.
questions. Do you have any studies with women with postpartum mental health issues? And or if you can, are there any studies of using this with children, or what are your thoughts about using this with infants and very young children?
Very young children, it depends on what you mean by very young children. There have been a lot of folks who've trained in this approach who have not been associated with research who work with children. So occupational therapists, physical therapists, mental health therapists, and social workers who work sometimes in institutionalized programs, sometimes in agencies, sometimes in private practice. So I hear a lot from them about how easy this type of work is to bring to children. But I would say that, there have to be at least probably, I don't even know,
Verbal.
probably, 7 or 8 to really work with some of the concepts and the processes that we're suggesting. So there's an occupational therapist I know was working with kids that age and was finding it extremely helpful. But more so with adolescents. Adolescents this is just as accessible to them as it is for adults. And there is a version of the Maya that has been made to be more kid-friendly. I'm not quite sure what the age ranges are that it's been used for, but I have not personally done research with children.
Okay. And the postpartum depression?
So we were, Ira, you're probably on this call too. I think I saw you. Ira and I were part of a study that was looking at pre and postpartum well-being for very low-income women. And the Maya was used, or some of the scales on the Maya were used. We weren't looking at this intervention per se. So, but there was some element of interoceptive awareness training involved prenatally for some of those folks. But the results of that were not, there was so much difficulty with recruitment and maintenance that I don't think we can really talk about how this worked from a research perspective with that population. But certainly my experience doing a smaller study with prenatal women integrating this work and interceptive awareness for them prenatally and then working with them personally postpartum was that these skills were extremely helpful for their own self-care and managing primarily their anxiety postpartum. Yeah.
One comment, looking at the quantitative outcomes, it seems caregivers will have a reduced symptoms and increased regulation, which would be so beneficial for children. So I guess teaching caregivers of children these skills to help them stay regulated as they take care of their child.
Absolutely. Absolutely. And, you know, if we get to the vignette that I have on these slides today, it's a man talking about his parenting skills, right? Like, I think that's very common, is that this work helps people be better parents, right? Regulating all aspects of their lives, including parenting. Absolutely. So just a little bit about this neuroimaging study. This was published in the past year. It was a very small pilot project with people who had moderate distress, but were otherwise pretty much healthy, involving a sustained attention process, just like we did together, this meditation we just did together during fMRI. So we compared those who got MABT to those who did not. And the exciting thing is that it was the first randomized controlled trial to show plasticity in the brain in response to a mindfulness-based intervention. So there haven't been as much intervention studies using fMRI because it's very expensive, but it really was extremely exciting to see this particular intervention show the change that we are expecting to see in response to interceptive awareness processing. So if you're interested in reading about that, it's in Brain Sciences. And the changes on fMRI, which were increased connectivity, were reflected and associated with increased positive responses on the Maya. So that relationship between what we're measuring for self-report in terms of interceptive awareness skills and what we're seeing in connectivity also came out of this study, which is extremely helpful because fMRI is too expensive to do in clinical trials. But if you can say that a measure is getting at this kind of change, that's very important to know. So this study suggested that it does. So the study that I'm just finishing, and I want to tell you a little bit about those other ones, which let me just go back here. All of these studies, if you're interested in reading them, they are linked to, they're all linked on the research page of my nonprofit, the Center for Mindful Body Awareness, so it's easy to find them. So if you're interested, there's a research tab. You can find all of those studies there if you want to read more. So this particular study, the preprint is now available for the pre-post finding on our outcomes. This is a study for men and women on medication, so that's buprenorphine mostly, for treatment of opioid use disorder. So this was 303 people across 6 clinics in Western Washington who enrolled in this study for a year, and half of them just had their continued medication, and half of them got MABT, so 8 weeks of MABT, and then we followed them for a year. And so these sessions were delivered at their clinics, and I'll just show you a little bit about what we found. So we're collecting different kinds of outcomes, but in this particular study, they were primarily self-report. We didn't look at physiological outcomes per se. And a little bit about who they were. They were ranged in age from 21 to 73, split male, female, 79% were white, and we have a range, 9% Hispanic, and a range of, which I didn't, it was too much information to put in here, but in terms of split on different races, Mixed race and Black were the races of the majority of folks who were BIPOC. Very low socioeconomic status. So the majority at most had a high school education. The majority, 72%, were on Medicaid, 23 on Medicare. Half of them, a little over, had chronic pain. 41% were above the screen off for PTSD, 49% above the screen cutoff for depression, and 40% above the screening cutoff for moderate anxiety. What I can tell you, we used a really, really extensive lifetime history, trauma history scale. And I think the trauma histories are extensive in this population. I think we had an average of endorsement of 5 different types of trauma, very, very high levels of childhood sexual and physical abuse, of sexual trauma amongst both men and women, of course, more women, and interpersonal violence, intimate personal violence was all extremely high. And we have a paper out of that, actually. So analyses, we looked quantitatively and qualitatively at the outcomes. And this is just from pre and post intervention. So, and what we saw was a significant reduction. What you see in yellow here are p-values that are highlighted in this right. These just indicate if it was a significant reduction, which just means that we're not finding an improvement by chance. In PTSD symptoms, pain severity, pain interference on activity, physical symptom frequency, and interoceptive awareness, all these things improved significantly for those who got this intervention compared to those who did not. And then we have looked across time. These have not been published yet. At 12 months, what of these were maintained with a group times time kind of analysis, as well as here I'm showing you at 12 months, between baseline to 12 months too. So PTSD was pretty maintained. It did improve for everybody in the study, but more so for those who got MABT. And the diagnostic criteria, you can see, dropped from 62 to 36 for those at MABT, and from 62 to 46 at pre-post for those in treatment as usual. And then those are pretty much maintained as the same across to 12 months. So anxiety was not significantly different between the two groups, but you can see again, if you look at the drop between above and below the cutoff for moderate anxiety in this box, there's a huge drop in anxiety for those who got MABT compared to those who got treatment as usual. And that was lowered and stayed lower for that group. Emotion regulation, again, it wasn't quite significant, but we can see in this graph that it was improved for both groups, but more improved for those who got MABT. So all these people are getting better. You know, they're on medication and they're staying on medication. This was a very, very stable group of folks. So they were not dropping out of their medication and treatment, because in order to be in the study, we needed them to be stable enough on their medication. These were a very committed group of folks. So we didn't see a difference in substance use, and we do see them all getting better over time, which you would expect. Medical symptom frequency, again, they're all getting better, but MABT group does better than the treatment as usual group in terms of the amount of frequency of physical symptoms over time. Interoceptive awareness, again, those who got MABT, it significantly increased and stayed increased through 12 months. this is what we typically see in these studies, and I think it's related to how much continued use of the skills people do. So just to give you an example of the self-regulation scale on the Maya, these are the kinds of questions we're asking on the scale. When I feel overwhelmed, I can find a calm place inside. When I bring awareness to my body, I feel a sense of calm. I can use my breath to reduce tension. When I'm caught up in my thoughts, I can calm my mind by focusing on my body or breathing. So there's a lot of scales of the Maya, and these are just two. I wanted to just give you a sense of what we're actually asking. So this one is more on emotional awareness. I notice how my body changes when I'm angry. When something is wrong in my life, I can feel it in my body. I notice that my body feels different after a peaceful experience. I notice that my breathing becomes free and easy when I'm comfortable. I notice how my body feels when I feel happy or joy. Oh, I think I already did that one. Okay. And then just gives you an idea, which is typical for most of our MABT studies, actually, that there's, as I mentioned, continued use of the skills people learned. So in this particular study, more than 60% of those who got MABT reported maintained regular practice over the year, which aligns with their maintained increased score in interoceptive awareness on the Maya. So you can see that up to 3 times a week or almost daily, we've got over half of the study folks endorsing continued use of skills. And the other thing we asked were qualitatively, those who got this intervention, we always asked them about their experience, what they learned from it. And then we used a qualitative software program to really look at those themes. So I'm just going to share these with you. These are themes about what people said was important to them. They had an increased sense of self-care and sense of self-agencies. And these are quotes that give you an example of that. One person said, I'm making decisions for myself, like getting my hair cut. I am putting on makeup and taking time for myself, taking a drive or a walk to have time to myself, listen to praise and worship music. Another person wrote, pretty much every day I meditate now. I learn to be more aware of my getting exhausted or overwhelmed, which I used to never care about. Another theme is increased awareness and acceptance. One person wrote, one thing that I learned through MABT is to give myself grace, and that it's okay to feel stressed or overwhelmed. That instead of running from it, to just sit with it and accept the hard things that are going on, and that I have a lot on my plate. I've learned to really accept my emotions more and just be with them versus trying to bottle them all up. I've also learned that certain physical pains in my body sometimes can have an emotional connection to them as well. Another person wrote, I recognize my emotions and I have more control of them because I can better recognize what causes them for the most part. I used to lash out and stay in bed on bad days I didn't want to face. And now I can talk myself through them. I feel so much happier and truly feel I can say I love myself now. Another theme was reduced symptomatic distress. One person wrote, I don't have feet pain anymore. Taking what I learned home has helped a tremendous amount to relieve the pain. It was so good to be able to walk around. I'm glad I got to learn. And another person wrote, MABT is a beautiful thing. It has generally given and taught me tools that I can use lifelong. Because of my lupus diagnosis, I have been suffering with severe panic attacks, and MABT tools such as scanning and breathing are the only things that help me either end a panic attack or prevent it. Fourth theme was improved emotion regulation, and a quote example, I have anxiety and am diagnosed with anxiety and depression. On my own now, I regulate my emotions instead of reacting to things or situations. To increase body awareness, I do a quick body scan. I do this every day for at least 5 minutes. My emotions have become more balanced and less up and down all day. I can close my eyes in the morning when I wake up and think about a certain area and place my awareness in that. It helps me relax in the morning and whenever I need it. I can do it sometimes during groups at the clinic, and it helps me relax. And lastly, improved OUD treatment and recovery. And one person's example, Learning to connect with what my body is telling me has helped strengthen my recovery process and taught me how to better cope with certain things during stressful times. I was also able to work through some past traumas during the MABT sessions, which I feel also has a firsthand connection with my recovery process. Having a safe place to open up about things on my mind at that moment and work through things that were going on in my life at that time, I feel also lowers my chance of relapse. So overall for this study, we had, as I said, very stable people on medication and committed to treatment, so we couldn't demonstrate improved substance use or treatment retention because they really were very highly abstinent from drug use. But they had very high levels of mental and physical health distress, and we see the PTSD symptoms improving. And I think in this particular group, trauma history often was brought up in their sessions, and oftentimes for the first time that they really brought it up and talked to someone about it because they really had very little mental health support in their lives. So that was fascinating to see. Highly significant increases in interoceptive awareness aligns with the qualitative findings indicating use of skills for regulation and self-care. And the pain and physical symptom improvement speaks to the relevance of this type of work for addressing pain and somatic symptoms. And overall, the findings align with neurocognitive models and research highlighting the relevance of this type of interoceptive awareness training for well-being and behavior change. So if we have time, let me just see where we're at. We don't really, but this is a clinical vignette. We had therapists that we asked them to write up a vignette after their work with their clients and share them with our research team over the many years. And so we have a lot of these. And for those of you who got the write-up, you can read this yourself if you want. I could take the time, but I really want to have time for questions, and we're at the end. So I'm going to let you do that yourself. But this is a man who really talked about his parenting and how much, you know, he had a trauma in his history he'd never told anybody about, and how much he used this intervention to really gain new skills. So helping clients learn interoceptive awareness helps with their self-care and awareness, their access and trust to body cues, managing stressors, managing chronic health conditions, increasing emotional balance and wellness and healthy behaviors. And I think for those of you who may be interested at all in bringing some of this into your own work with clients, the things that are really important is having, as a clinician or a therapist, capacity for self-presence and interoceptive engagement for yourself. We can't really teach others if we can't do this work for ourselves. So that's really key. Comfort and skill in teaching this type of work. That comfort is really necessary for using this in your own practice, and you can take little pieces of what this intervention is and integrate them into practice, and people do that. The trust and sense of safety is really important in the therapeutic relationship, as I'm sure you're all aware. For learning this work, the individualization of the learning processes to match the client where they're at is key, and following their own unfolding process rather than it being our agenda is also a big part of this process. So those are just some highlights about what we know is really important for teaching this work. We also really think that this work is very important, and this was brought up in what Monica said recently about our own self-care as therapists and providers, and how much just taking the time to kind of focus in and notice how we're feeling helps us manage our daily stressors, be emotionally more balanced, increase our presence with our clients, and prevent burnout. So my nonprofit center is going to be focusing more in the future on not just training clinicians on how to bring this work to their clients, but also just on offering more opportunities for therapists and providers of different types and different disciplines just to learn these skills for themselves for these purposes. And we're also working on really now bringing this more into mainstream care. So we have a nurse doing this work at Harborview Mental Health Clinic. We have clinicians we've trained, for example, in the chronic pain clinic from implementation study that are still providing the service ongoing. We have our own clinicians that we've trained in research who are now working on bringing this work into health clinics wherever they are in Western Washington. So this is kind of my newest focus.